of the agency, especially what we're doing to curb the scourge of substance abuse and illicit drug trafficking, as well as getting your feedback so that we can continue to improve on our deliverables and serve the society and humanity better. This conversation would like to let you know that it's indeed recorded and is streamed live on our other social media handles at Ndlea01 on Facebook and at Ndlea_Nigeria on YouTube and other channels. We're live on X already. Okay, you can always go back to listen to the recording and share with others. You can rest assured the recording of this conversation, it's live soon after this space. Before I invite our special guest today to make his presentation, let's remind you of some of the activities of the agency quickly in the past week. That comes in our news highlight segment, which will be taken by Miriam Musa and Ndlea. Miriam, let's listen to the update you have for us this week. Please go ahead. Thank you. Yes, Miriam, you are muted. Please go ahead.
Thank you, sir. Good day to everyone, and thank you for joining us on this week's X Space. My name is Musa Mariam, and here are the Ndlea news highlights for the week. Ndlea boss guarded shrine used to store illicit drugs. Arrest 2 in Edo. Intercepts 8.2 kg methamphetamine concealed in imported chocolate parks in Lagos. Nab 76-year-old grandfather with 340.8 kg drug consignment in Abuja. A snake-guarded shrine used to store illicit drugs in Igor community, Benin City, Edo State, has been raided by operatives of the National Drug Law Enforcement Agency, Ndlea, who detected a specially constructed large hole storage in a wall covered with wallpapers and fetish objects. Different quantities of illicit loud, all strong strains of cannabis with a total weight of 8.743 kilograms were pulled out of the deep hole dug in the wall of the shrine building. At least 2 ladies, Sonia Chinonso Ezumezu and Risika Tutijani, were arrested during the intelligence-led operation on Tuesday, 18th June 2024, after the big black snake guarding the shrine was demobilized. In the same vein, 2 suspects, Obi Ferguson, 45 years of age, and Ernest Abanom, 46 years, were arrested on Saturday, 22nd June, when Ndlea operatives raided Usen Forest in Ovia Southwest Local Government Area, Edo State, where 209 kg cannabis and a motorcycle were recovered. Meanwhile, Ndlea officers in Lagos have intercepted a carefully packed consignment of 8.2 kilograms of methamphetamine at a motor park in Mazamaza, Ojo area of the state. The highly addictive illicit substance, also called ice or crystal meth, was packed in important Dunkin' Total Love chocolate wraps and then concealed in the casing of 3 loudspeakers. A 39-year-old suspect, Michael Ojiomome, who was sending the consignment to Owerri, Imo State, was promptly arrested on Wednesday, 19th June at the park. In Abuja, operatives on Tuesday, 18th June, intercepted a white Nissan Frontier pickup truck with amber lights and fake registration number of an agency at Kiyi Village in Kuje area of the FCT. The vehicle was loaded with 454 compressed blocks of cannabis sativa, weighing 340.8 kg, procured at Uzeba, Edo State. A 76-year-old grandfather, Mr. Francis Omofa, linked to the consignment, was arrested. He claimed to have been in the illicit drug business for 10 years. While commending the officers and men of Edo, Lagos, and FCT commands, Chairman Chief Executive Officer of Ndlea, Brigadier General Mohammed Buba Mara, retired, noted the balance in the drug supply reduction and drug demand reduction efforts, as well as those of their compatriots across the country. He charged them to maintain the ongoing offensive action against drug cartel as they continue to intensify their war against drug abuse, wider social advocacy campaign. That's it on arrest and seizure. Over to you, Netta.
Thank you, Mariam. My name is Netta Wedozie, and here are some of the wider activities across the country for the week. In addressing the problem of substance abuse, the National Drug Law Enforcement Agency (NDLEA) has launched a comprehensive awareness program to mobilize, inform, and empower people on the risk of drug abuse in various settings, including schools, churches, motor parks, workplaces, and communities across the country. This is done under the social advocacy initiative called War Against Drug Abuse WADA campaign by NDLEA Command in partnership with other stakeholders like NGOs, CSOs, FBOs, and CBOs every week. On Monday, 17th June 2024, the Enugu State Command of NDLEA paid a WADA advocacy visit to the State First Lady, Mrs. Nkechinyere Mba, emphasizing the importance of collaborative efforts in combating drug abuse. Speaking on the dangers of illicit drugs, the Anambra State Command on Tuesday, 18th June, delivered WADA Enlightenment Lecture to students of St. Peter's College, Nibo. Continuing the advocacy activities on Thursday, 20th June, the Benue State Command engaged students and staff of Federal Government Science and Technical College, Utupa, sensitizing them on the need to abstain from indulging in substance use. In the same vein, Osun State Command of NDLEA facilitated WADA sensitization lecture to students and staff of Apostolic Grammar School, Iresha, on same Thursday. On Friday, 21st of June, the Oyo State Command facilitated a WADA enlightenment lecture to students and teachers of Emmanuel Baptist High School, Oyo, highlighting the role of education in empowering youth and resisting substance use. The Abia State Command concluded the week's WADA activities by delivering an advocacy lecture to Muslim faithful during their Jumat prayer in Umahia. That's the update for this week. My name is Netta, and I hand you over to our host, Mr. Femi Babafemi.
All right, thank you very much, Miriam and Netta. Welcome back from the news highlight segments. Now let's remind ourselves about some of the rules guiding our engagement on this platform today. Don't forget that we have the were seated and ready to have a conversation with us, and so we would like to join us to please let's remain muted, especially for those that are already on the speaker's corner. And as soon as he finishes his presentation, then we can start inviting individuals to move their questions or make contributions. Please let's ensure that we do this in few seconds so that we can have as many people that have been eager to speak with him or ask him questions to have their time, so within the limited time available. We don't encourage unauthorized interruption, and here we don't discuss politics, so please let us stick to the rules so that we can all enjoy and benefit from the conversation. Would I appreciate your usual cooperation. Yeah, before, I think that definitely I'll like to Ndlea Car Center and Save Our Families Soft initiative, but then that will come immediately after the Shama's presentation and his engagement with all of us. So at this point, we'd like to introduce to us someone we virtually all of us already know. He is a soldier, a diplomat, an administrator, a politician, and author. I like to also tell, for the benefit of quite a lot of people on the space, especially those joining us from other jurisdictions outside of the country, that indeed the Mawas are 4 generations of soldiers. His grandfather, his father himself, his late younger brother, his own son, also all of them, all soldiers. He is indeed an officer and a gentleman, reliable, dependable, and old school for that matter. Indeed, distinguished and an unblemished military career spanning 1966 to 1999, and he's had his military training in USA, that's United States of America, India, Pakistan, Nigeria. He has set unparalleled record in Army promotion exams as staff college trainee. He is the first in order of merit, one in his lieutenant to captain practical promotions exam 1975. He is also the first in order of merit from captain to major reaching as staff college qualifying exams in 1981. The same thing in his junior staff college course 1978 to 1979, and indeed command and staff college course also. All of this, he came first in order of merit. In 2022, just some few years ago, the Nigerian Army indeed established the Marwa Award of Excellence Prize to officers who come to captain practical promotion exams. That to a recognition of the standard already set by General Marwa in the Army. He holds a master's degree in public and international affairs from the University of Pittsburgh, USA, and another master's degree in public administration from Harvard University, also in USA. Indeed, like I said before, he is an author and he's authored a number of books, including Nigerian Army Military Dictionary. He's also authored another book in the military called Appreciation. That's the process of analysis of the conduct of military operations. He's also written another one also for the military, Grand Tactics. He has also co-authored Nigeria in Peacekeeping Operation. He's the recipient of 2 national honors, Commander of the Order of the Niger, as well as that CON, as well as Officer of the Order of the Federal Republic. Yes, he is equally. He also holds Armed Forces Award of Distinguished Service Star, that's DSS. As a lot of us know, he is the military governor of Obo and military administrator of Lagos State, the Republic of South Africa, with concurrent accreditation to the Kingdoms of Lesotho and Swaziland. As chairman of Defense Industry Corporation, General Marwa led the cooperation to manufacture from scratch RPG-7 bazooka, 60 mm mortar and 81 mm mortar. All were test fired under the pressure of then President Olusegun Obasanjo and the Minister of Defense and Service Chiefs. By the grace of Almighty God, he is today the chairmanship executive of Ndlea. Ladies and gentlemen, please join me in welcoming His Excellency General M.B. Marwa, retired, as I invite him to unmute himself. He's joining us on the handle Ndlea 001. Let's invite him to unmute himself while we listen to him spend the next couple of minutes discuss our topic for today, that's drug abuse, Ndlea, and preventive interventions. You are most humbly welcome. Thank you very much, sir.
Thank you very much. Good afternoon, friends and colleagues. First, let me apologize for my inability to be present Friday last week. I was suddenly called to the villa on some assignment, and so I missed that chance. But I'm very delighted to be with you this afternoon on this 101st edition of the Ndlea Interactive Forum on X Space. I've been a guest once on the 25th edition on 12th August 2022, where I discussed crystal methamphetamine and its abuse in Nigeria. Today, I have the honor of appearing for the second time as a guest, and this time to talk about drug abuse, Ndlea, and prevention interventions, in line with the theme for this year's International Day Against Drug Abuse and Illicit Trafficking, otherwise known as World Drug Day. The 2024 World Drug Day theme is "The evidence is clear. Invest in prevention." Let me start by saying that prevention is an effective intervention in drug use. As we all know, prevention is better than cure. It is far more cost-effective to prevent drug use than to deal with its consequences. Prevention can be described as various efforts or activities that are meant to ensure that new individuals or groups do not enter the unfortunate field of illicit drug use, and that they do not find themselves in a vulnerable position whereby they would contemplate using illicit drugs because of ignorance, peer pressure, environment, or social economic conditions. When we talk about prevention, the target audience is mostly young people. Already we know a lot of them get introduced to drugs for the first time between the ages of 17 and 19 and in their early 20s. Now that is not to say that some of the boys in secondary schools at much earlier ages do not use drugs. This is the period when they are vulnerable to peer influence and they have impressionable minds that can be easily influenced by what they see and what others do. As a country with nearly 15 million drug users between the ages of 15 and 64, based on the 2018 National Drug Use Survey, we are under pressure to ramp up our prevention intervention because a World Drug Report has already forecast that by 2030, there will be a 40% increase in the number of people who abuse drugs in Africa, and the increase will be mostly young people. So when we talk about prevention, we are talking about preventing teenagers and especially young adults from drug use. Most of the research conducted in the past 3 decades indicated that an evidence-based prevention program can systematically address conditions that increase the risk of drug abuse among vulnerable populations. Such interventions help to build or reinforce their resilience against the impulse to use drugs and steer them on a path away from substance use and substance use disorders in general. Since Ndlea commenced its renewed fight against the illicit drugs scored in 2021, we have ramped up prevention activities. Our work at Ndlea is not only focused on arrests, convictions, and seizures. We are equally pursuing and implementing drug abuse prevention strategies, of which I will mention a few. But just before that, I ought to state that we have 30 counseling rehab centers of our own in the various commands. There are 7 commands that we are yet to install them. By the end of this year, we'll add 3 more, bringing the total to 33. Now, these are some of the prevention strategies that we've been employing since 2021. First is the War Against Drug Abuse, WADA advocacy, WADA advocacy. WADA was launched on June 26, 2021, anchored on a whole of society approach to create awareness, education, and information for the public. In schools, we set up the WADA clubs to drive anti-drug advocacy among students, and I have myself physically been present at the launch of some of these clubs in the schools. We have been conducting awareness campaigns in schools and other places where we can reach out-of-school youths. Indeed, between 2021 to 2024, the agency has embarked on 6,423 sensitization and education programs targeting young people in schools and 987 programs for out-of-school youths, creating awareness on the dangers associated with drug abuse. All the commands have been tasked by me since 2021 to make sure that they visit at least 2 schools. At least 2 schools, secondary, tertiary, at least 2 schools. 1 market and 1 motor park, at least. Church and a mosque, at least, weekly, to drive this process. And I have myself participated in some of these activities, some virtually. I do not know if there are some listening to me now who hail from Abeokuta. I did part of my primary school in Lafenwa, and I addressed the students on advocacy virtually from Abuja, the students of Olumo Primary School a couple of months ago. So we push from primary school upwards on the wider advocacy. We also get communities involved. We get the traditional institution involved, and as I've said, the clergy is very, very important platform. It has a structure. At the top of it is the National Interministerial Committee, which I chair, and is made up of the relevant ministries, departments, and agencies, but every organ, from the presidency, the Office of National Security Advisor, the DSS, the NIA, Secretary to the Government Office, this to show that the government, we have the will of the president behind us, the political will, and we have this structure that addresses drug use, drug issues at the national level. NAFDAC, these are all bodies that are involved. The customs, immigration, they are all with us. At the state level, we also have the State Drug Control Committee, which handles at that level the issues of drug control, and below that, the local government drug control committee. And just yesterday, I received in audience the executives of the ALGON, Association of Local Government of Nigeria, led by their president. We had a discussion because we need the 774 local government councils in Nigeria to join us in against drug abuse. We also work with the Governors' Wives, Governors' Spouses Forum. That's a national association of all the governors' wives in Nigeria. Equally, the Governors' Forum themselves, we partner with them. The other intervention program is the UNODC's Unplugged program. It has been proven that school-based programs are The program has subsequently been adopted and is being implemented in schools across the country. Now, the NDLEA drug is for all institutions and bodies. Its main target is tertiary institutions and secondary institutions, where its utility includes, among others, one, an early detection system for those who have started abusing illicit substances and cannot be weaned off the habit with early treatment, and two, a restraint for students who have never indulged in the use of illicit substances but could find themselves in compromising situations. I'm happy to tell this virtual audience that a couple of universities have adopted the policy for their students. We are pushing for it to become an enshrined policy and an integral part of the tertiary education system in the country. I know the Honorable Minister of Education is with us in this. In fact, at the launch of the World Drug Day, we had on the sidelines a discussion with him and have agreed to meet as soon as possible for us to codify this matter of drug testing in schools throughout Nigeria. I should touch on the Save Our Families campaign, which was also launched, but of course, Femi has said this is a matter that will be discussed. Now, the family obviously has to be the beginning point in fighting drug abuse. In Nigeria, well, I'm sure elsewhere, that we have to now face our own country, where sometimes the parents themselves are the abusers. When the parents abuse drugs, what do you expect the children to do? They will copy. Tendencies for them to copy. Whereas we want the parents not only to abstain, but to bring the children up, put discipline, let them know right from wrong, the dangers of drugs, and why they should stay away from drugs. This has to start from the beginning. That you find even the parents sometimes hide the facts that their children are abusing drugs until it begins to get out of hand. When you start experiencing drug use disorder symptoms, that's when they bring the matter up. So the essence of the Save Our Families campaign, obviously, is to promote the use of drug testing kits within the family. We have thousands of these kits in all our commands, and very soon they will go out to pharmacies. The NDLA drug test kits are, of course, unique and the most reliable. In Nigeria, you ask someone to go test for drugs, you can go to the corner, scoop some water, and present it. But you couldn't do it as urine. But you won't succeed with that in our own case because our kits discriminate whether it is urine that you presented or some other substance, including all the attempts by people to try to mask their urine using all kinds of substances. You won't succeed with the NDLA test kit because we also have taken care of that. We are looking at a very reasonable price so that this thing can go around. The advantage is apart from the drug demand reduction that we expect, because when your children know that you have these kits and you are going to test them, the tendency will be for them to keep off drugs. Should they not, at least you will catch them early before it becomes a serious case of addiction and treat it. Now, the other intervention on prevention comes from the Pharmacy Council Act, which was enacted in 2022. Now, this act revolutionizes the pharmacy practice in Nigeria. You have to remember that Nigeria may probably be the one country on earth where a patient visits a pharmacy and himself tells the pharmacist the medicine that he wants to be given to him, instead of a doctor prescribing what ought to be given. This is apart from your basic over-the-counter medication. So the Pharmacy Council Act cures this situation. The new law, that's the Pharmacy Council Act law, is meant to sanitize the retailing of orthodox drugs and ensure strict access to pharmaceutical opioids and related drugs. Contrary to good practice, once upon a time, drug retailing in this country was like an open market, whereby anybody, including those without relevant training, certification, or license, dispensed drugs anyhow on the street in a fashion that fueled abuse and addiction. Now, that contributed largely to the abuse of tramadol, codeine, and related drugs. In fact, let me tell you, the case of the patent medicine stores. In Nigeria, we have well over 1 million patent medicine stores. Those are the community stores that ought to sell over-the-counter medication only. But but you find them doing all kinds of stuff. And before this Pharmacy Council Act came into force, the old acts, you will be surprised, the qualification needed to set up a patent medicine store was if you can read and write. There's nothing there about primary school, secondary school, or any qualification. Just if you can read and write. So you can imagine the type of abuse. For this reason, just about 60,000 patent medicine stores in the country have proper registrations, whereas over 1 million actually do not have the correct license. So the new Pharmacy Act also is set to correct this, as well as stiffer penalties for those who sell drugs anyhow without qualification and beyond the capacity of what they ought to sell in that pharmacy. Now, the destruction of cannabis farms. We have over 10 million Nigerians that use cannabis from the drug use survey, which is one of the highest in the world. One of the elements of prevention is our offensive action operation, where we seek to ensure that cannabis doesn't get to the cities and streets by carrying out interdiction at the sources. So we go on a search and destroy action against cannabis farms all over the country, and this has led to scarcity of cannabis in the urban areas. We also shrink the space of availability and access through our round every day at the port, houses, highways. We have destroyed over 1,000 hectares in 3 years of cannabis plantations. And in 3 years, we have seized over 7.6 million kilograms of illicit substances. Obviously, an aspect of prevention, because when you see them away from accessible to would-be subjects, I should draw attention to our Preventive Development Unit under my office. This is the newest unit that we have formed, and it seeks to encourage and persuade us to instead of growing cannabis with all the family's name in the mud, you could be jailed and so on and so forth. Why don't you grow something with a comparative advantage from the part of the country that you are in, whether it is wheat or rice or any of the other substances? You have cash crops, cocoa, palm. The beginning stages of this campaign for alternative cropping, and it's not like we're creating something new, it has happened elsewhere. The most successful alternative development is in Thailand, and I already have had a team visit, understudied them, and we're in the process of building this unit up. We will soon present it to government and to the public. Now, these are some of the prevention strategies we are currently implementing. By and large, prevention is an intervention activity that is not meant for law enforcement alone. Far-reaching results are achieved when it is implemented as a communal assignment involving the family, which is the basic unit of society, and other important elements of society, including the community, church, mosque, social group, and so on. It means that we all have a role to play, one way or the other. That rule starts with being aware and well informed about the dangers of abuse of illicit substances and subsequently helping younger people to stay away from that. At NDLEA, we are exploring all options to ensure that we prevent our young people from abusing illicit drugs. And we call on the public to join us in collaboration on this task to ensure that we secure the future of the coming generation. I thank you for listening, and I'll be glad now to interact, take some contributions from our past guest speakers, and if there are questions, I'm here. Thank you again.
Our special guest today is no other person than His Excellency General M.B. Mara, retired Chairman Chief Executive of the National Drug Law Enforcement Agency. That's succinct and very clear. Thank you very much once again. We would like to quickly switch into the conversation so that we can take as many people as possible, questions, contributions, but let's please ensure that for those asking questions, let's our topic, our subject of conversation as much as possible, and for our contributions, let's also restrict ourselves so that we won't have to waste time diverting or getting into some distraction. So join us, so please ensure that we restrict ourselves within few seconds so that we can give opportunity to as many people that want to ask questions or make contributions. Let's start that. Okay, I can see Dr. Kemi Onuloro is already. Corner again. Okay, let's start this. Let's get Dr. Kemi. Please, let's ensure that we don't spend more than 30 seconds.
Okay, good afternoon, everybody. Chairman, good afternoon, sir. Thank you so much for your wonderful work. And I want to commend you for the terrific job you have done in reducing prescription drugs on the streets of Nigeria. When I came here 2 years ago, I came here because of tramadol and a lot of prescription drugs. And these drugs belong in clinical settings, pharmacies, and not on the streets for recreational uses. You've seen what happened in America with fentanyl. You've seen all over how people are on these drugs acting like zombies, eating their flesh and all that. We don't want to get to that page. We did a good job with fentanyl. We had a show here discussing fentanyl and how we prevent it from coming to Nigeria because it is the
Excellency, the chairman. Let's take the next contribution or question from, okay, Ibrahim Kuru. Please go ahead and mute yourself. Let's hear from you. Okay, stable. Ibrahim Kuru, if you are stable, if you are okay, otherwise I'll move to the next person. Okay, let's take the next. Black, that's it. Black, that's at Remayes 001. Black. Okay, I'll move again. Umar Farouk Sani, please go ahead. Okay, for all of you that I'm giving this opportunity, if it's your network. Okay. Okay, let's take the next one from Omoba Remy. Omoba Remy, please quickly go ahead. Already, I'll have to switch.
Can I go, please?
Those that are here to be giving mic. Okay, let's have John Ogunjimi, please.
Sir.
Okay, yes, Omoba Remy. Quickly, please.
Yes, hello. Yes, good afternoon, everybody, please. And well, if there are any rehabilitation centers across the state for those that are into drug abuse and all, any rehabilitation centers and all, that's what I want to ask. Thank you.
Okay, thank you. Thank you, Omoba Remy. Your Excellency.
Yeah, we have rehab centers, 30 of them in 30 states, and another 3 will come on stream. What you do is to call 0800 10 20 30 40. That's our helpline, free. Um, and by the way, they speak in Igbo, Yoruba, Hausa, English, and Pidgin English. It's a helpline with psychotherapists and counselors on their end of it, but they also answer questions as to the locations of the rehab centers. So you can ask specifically for where you probably want someone to be helped, and they will guide you.
All right, thank you very much there. Okay, let's give John Ogunjimi the next opportunity. John, please go ahead.
Thank you very much, sir. Your Excellency, thank you very much for the opportunity. And first, I would like to congratulate the NDLEA on the 101st episode of this. It has always been enlightening. I'm less active as I used to be, but I've always been in the background listening. I just wanted to mention something regarding the testing in universities. I'm a forensic scientist. I major in crimes and investigation, and I teach forensic university in a Nigerian university. And I'm excited about this because I've used my platform to encourage students to avoid drugs. And I just wanted to raise a point on behalf of my students as well. When this point comes, we have students who are just starting their career, specifically in forensic science, and I heard that the NDLEA has opened or is working on opening a forensic laboratory. So it's just a plea. It's just a plea for a kind of partnership with the NDLEA to have our students come for a kind of industrial attachment or internship, if possible, with the NDLEA, while we continue to encourage them to shun drugs and to avoid it. Thank you very much.
There's a disconnect.
Apologies.
You know, John, we can't hear John.
Okay.
You mentioned
John,
about tests in Nigerian University. That's the end of it. We didn't hear anything more.
Okay, John, you may have to come again.
Okay, sir.
I think Mahmoud, check your connection,
now,
please.
sir? Can you hear me now, sir?
Okay, I can hear you. I just want to be sure that his connection is fine. Mahmoud, check your okay. Okay,
yeah.
Go ahead, John. You can can go over your stuff.
So just to summarize, my request was for a partnership or possibility of a partnership with the NDLEA for our students. I said I teach forensic science in a Nigerian university, and when the time comes for, it's a new course, but when the time comes for our students to have internship or industrial attachments, I've heard of the NDLEA forensic chemistry laboratory being set up, and just to seek a further partnership with the NDLEA for the training of our students.
Yeah, I think it's some network issues.
Yes,
I'm sure that I heard about the partnership, in case you're hearing me. I don't think there's anything bad there, but we have to examine further. Write us, and your contact person, you can make use of Femi, Baba Femi, so that we can take it up from there. Your university is where? Is it in Lagos or where?
In Ogun State, sir.
In Ogun State.
Yes, sir.
Right, we have a forensic in Lagos. We can look at it and get back to you on it. You can write and put it through Femi. And I wish you more success.
Thank you very much, sir.
We need more forensic scientists. Yeah.
Thank you very much, sir.
all right, thank you very much. For those asking for the mic, I think if I have tried to approve a number of you, Loretta from Chicago, Ibrahim Kuru, Youth Engage Youth Network, that I believe it's Ibrahim in Gombe. Please, you may have to have been approving, but it's bouncing back. So check. I suspect strongly from your end. I'm seeing your messages, but I'm approving. Not that I'm not approving, but it keeps saying error. So check your end. You may have to opt and then hopping inside again. Thank you. Okay, let's take the next question or contribution from Isaski. Isaski, are you ready? Please go ahead.
Good afternoon, everyone. I can see my favorite journalist is also here, Doctor. Good afternoon, Your Excellency. Good afternoon. Actually, quite okay. Most of the times I don't really attend this, but most occasionally I do come, and I actually I am on the ground. Well, I'm equally really happy because it's actually a very good it's actually a very good platform to actually enlighten we the youth actually that are coming up. But in as much as I am saying kudos to what NDLEA are actually doing, I also want them to actually intensify efforts to go towards the grassroots itself, especially we in the north here. There are a lot of things that have actually ventured people into drug abuse here in the north. A lot of people doing drugs, not that because of anything, but at times can be due to depression, just to actually get over a lot of things, because there are ways people do not are unable to express themselves in the north to people. There are things that happen, there are abuse that happen to people, but when you can't voice out yourself, you find way to channel your anger. Maybe there are things through your peer that they will give. I actually finished from maybe Usaria, and I have seen a lot of people doing drugs. I do not really want to call their names. I have seen my friends also. When you ask them, they tell you, if you know what is happening in my family, a lot is happening. They do not have people to channel in their own to channel what is actually going through with them. A rehabilitation center is actually one good thing, but even aside from that, we need to have at least one or two educators from the NDLEA, because these days once people see NDLEA, they get afraid. Even if you've not committed, they just start running helter-skelter. No, these people are actually going to catch me, they are detaining me. No, but if we can have friendly educators from NDLEA, meet these people, interact with them, so that people will actually be very free with them. They tell you their life problems, and maybe from one or two you can be able to help them. Because if at times some of the officials keep using force, even though I know it's just a little from the force, but most of them are actually quite friendly, because when they stop you, they tell you, come down, we want to check. It's just a routine. At times you will even see some people advising you from the officials, which I have seen one-on-one. They will tell you what you are doing is not good. At this age you are not supposed to be doing this. Sometimes they detain, sometimes they even allow. But I'm more keen on seeing the grassroots, people from those villages. A lot of things are actually happening there, but maybe the outreach.
It's asking, let's round up so that we can give others. Thank you. Okay, just mute yourself now, it's asking, because we may have to take you to the listener so that His Excellency can, we can approve others, and then His Excellency can respond now. Please go ahead, sir.
Yes, the point that you made has been quite worrisome for people to be afraid of coming forward. And let me take this opportunity to ask. We welcome those in distress or who have issues with drug use to come forward, either call the helpline or come forward to our commands, where in the various states, capitals or area commands within the local government areas. If they own up, they will not be arrested or treated as suspects. They will be treated as users who need help. I know the situation in the north, probably especially like the housewives, owing to poverty, some cultural issues, some stigma issues. We encourage people to come forward. They will not be arrested or under any fear or worries. We are here to help, and we carry the advocacy down to communities. Thank you.
All right, thank you very much, Your Excellency. Let's, for those struggling to get the mic, please, like I said, Loretta just opted out and came back, and her request has been approved. Please do the same thing. It's not from here, it's from your end. All right, that's Ibrahim Kuru. Just go out, then come back in and request. Will definitely approve, and then maybe the most likely that it will go. The same thing with Ibrahim Ingombe. Please do the same thing. Tope, Igwemini, Oracle, and all of you, Swelling, all of those requesting for mic since, please, it's not as if we're not approving. It's because your network is resisting or rejecting. Okay, we'll take the next from Dr. Loretta. Dr. Loretta joins us from Chicago, Illinois. Please, Loretta, go ahead.
Thank you, Mr. Wafemi. Your Excellency, sir. Thank you for joining us. It's very interesting because last week I was actually coordinating or facilitating with Mr. Babafemi, helping people get in and working around the network. And today I've been kicked out, but I'm glad I'm back and I can lend my own voice. So first and foremost, let me congratulate you and your team for sustaining very strongly this platform and all the good work you're doing in Nigeria. And we are very proud. And coming from someone like me that is in the diaspora and doing quite a lot of work around substance use disorder in Chicago and the United States, I'm very happy that we're having a very strong footing and on the demand and the supply side of substance issues in Nigeria. Very much. I mean, like I told you the last time on this platform, I don't even expect anything less because, like I said last time, I was a baby when you were there at Lagos State that year, and I know what you did, and I'm not surprised considering what you've been doing. So thank you so much. You've not, like they will say on the street, from our hand. My question is in two folds. One is the last time we had on this platform, the Kaduna State substance use guy, and he talks about one major challenge, and that's about difficulty in integrating substance use into the curriculum. My question will be, what are we doing? Because I'm sure it's not just about Kaduna State, it's a national thing. Because I'm very optimistic that if we're able to push that agenda and we begin to catch them young in terms of prevention, that's a very good way to go. I know the team is doing a lot of work, but I want to know the backing of the UBE, the primary education and the government, what they're doing to support Ndlea to make sure we get that curriculum in the students' classes, both at the primary and the secondary level. The other one is, like I'd spoken with Dr. Babafemi last time about the fentanyl challenge and where we are in terms of harm reduction, because I'm a harm reduction advocate and specialist. And I asked him about the Norcan thing, and I said to him, what can we do? Is it permitted to have Norcan in Nigeria? For example, if I want to visit and we want to send some Norcan, because where I work, we can talk about how we can get more Norcan into Nigeria. But the first question is Norcan accepted in Nigeria? Can we advocate for Norcan as a first line harm reduction for overdose crisis? And the last one will be, thank you for all the good work. And we hope that we can, this last question is on behalf of my husband. The last time he came, he thought we were going to be on the platform last time. And the question was, what is the government doing in terms of pushing the policy for Ndlea to be the cover organization or agency that looks across or that is able to coordinate all the substance issues, even with the Federal Ministry of Health, and get adequate budgeting or get adequate funding from the government to see across board the demand, supply, and other aspects of our concern. So these are my three questions, and I just hope I'm clear about them. And thank you for, sir, you have to, all of us on this platform, we all need a bottle of Coke because we were all waiting for you last week. So thank you for coming.
I believe Loretta asked question on behalf of the entire population of Chicago. Thank you, Loretta, because your questions were threefold. I yield the mic to His Excellency to respond.
Thanks, Loretta. You deserve more than Coke, actually, for your patience, all of you. And if I'm not mistaken, were you not on when I spoke in 2022?
Yes, I was on. I was the one that told you. I was just like our old when we were the administrator in Lagos, and we're so proud of you. And I remember the Keke Marua thing as well.
Thank you very much. And I think I asked you about the Chicago Bears.
Oh yes, you did. You did. We are getting stronger.
They used to give us a rough time in Pittsburgh. The Pittsburgh Steelers were always having the problem with the Chicago Bears at the time. Yes. Thank you for your kind remarks and also for your professionalism. Now, the issue of integrating drug use in our educational curriculum. In 2018, the former president, President Buhari, set up the Presidential Advisory Committee for the Elimination of Drug Abuse, which I had the honor to chair. This committee was expected to bring solutions to drug issues in the country. Eventually, we submitted the report. But within that committee, it was a 27-man and woman committee. We had a director from the Ministry of Education. I remember, I think Dr. Gigina, that was her name. And this matter came up for discussion. We were also briefed properly by the ministry because we paid full visits to the minister and so on. And they assured us that there is in the educational curriculum in schools the matter of drug use. But this is a matter also in my item of this, in my items for discussion with the Honorable Minister of Education when I meet him. It's very important at this stage for us to confirm and be certain it is there. And it's not only for it to be there, but there have to be qualified teachers trained to teach it in the school system. So that one is definitely
Okay, let me quickly apologize for that glitch. It was obvious that the network was heading towards that, but then we're glad that quickly. Dr. Asia Damubio, you may have to quickly come back so that you can land and then the sham, because you are still at the preamble before the network went off, before the glitch. So you may have to quickly come back and let's have your question well concluded so that the chairman can respond to that before we proceed to some other persons. Okay, but then let me quickly, I have quite some people that were sending in questions, those that we could not approve their visit. So let me read that of Dr. Dokun Adedeji. Dr. Dokun Adedeji asks, my question to this chairmanship executive is this: how will the NDLA have working mandate with the following groups? MAN/NECA, I believe MAN is Manufacturers Association of Nigeria, then NECA, Nigerian Consultative Association, Employers Consultative Association for the workplace, the vice chancellors not to be expelling students who test positive, and the heads of the religious bodies. So I'll come again. The question is, how will the NDLA have working mandate with the following groups? That's MAN/NECA for the workplace, the vice chancellors not to be expelling students who test positive, and the heads of the religious bodies. That's the question from Dr. Dokun Adedeji. Dr. Dokun is on the platform, but he's unable to get to the speaker's corner. So I invite His Excellency to respond to Dr. Dokun Adedeji.
Yes. Yeah, Dr. Dok. We have and are open to advocacy and collaboration with these institutions, some of which we already have started, like with the vice chancellors. As we are working with several of these vice chancellors. In fact, within the last 3 months, I think I've received 3 different vice chancellors and their management in my office here to drive home collaboration. And from my own side, as NDLA chairman, we encourage them to set up at their own levels at least counseling units, and the focus should be for children and our youths who are afflicted or found positive to drug use to be to get rehabilitation. I think that's where we want them to face, not expulsion. But again, some of the universities have their own codes and their own operating procedures. But we continue to encourage them that the students that are positive should go for counseling and rehabilitation. And when they eventually get negative, then they come back and resume their studies. The same, we are collaborating considerably with the religious bodies. In fact, I think only next week CAN has sent an invitation on some very important discussion here in Abuja. So down to the levels of our commands, down to local governments and communities, the NDLEA partners the clergy at the various levels, both for advocacy and for them. We do advocacy for them to beef up their own knowledge on drugs, because we want them to include this in their sermons, both in the churches and in the mosques. So this is a very important aspect. And though you mention religious bodies, the same thing goes for traditional institution, the same partnership with traditional institution. So as for MAN and NECA employers, we go on advocacy to workplaces, to motor parks, markets, and we're always open. We encourage associations, they can reach out to us and we'll send awareness advocacies to support them for us to work together. Yeah. Now, Dr.
All right. Thank you
Hasia,
very much. Okay. Okay. No, she has not actually landed. Maybe you want to allow her to finish up her questions.
yeah,
That's Dr. Asia.
okay.
Okay, Dr. Asia, please go ahead. Dr. Asia, okay, go ahead.
Yes, Dr. Babafemi. I don't know where I stopped, but I'm sorry about that, Your Excellency. I would just say that the question Dr. Dokun asked has, and the answer the Excellency has given has answered a few of my concerns. And then, of course, I was saying that he started off by rightly saying that the home front is very important, especially in terms of prevention and psychoeducation for recovery and all the works. And how we can reach parents and caregivers, also. So the issue of NACA, NLC, all the other NGOs that Your Excellency has spoken about, I think these are all part of it. But when we want to now meet with parents, in the schools and the universities and other institutions that we are going into, because I think a lot is going on in the institutions right now. So meeting the parents who are supposed to be caregivers to these users or prospective users, you can never tell, or those trying to come out of it, is also very important. So I think it should be holistic, so that we are not dealing with just a section of the users and leaving off their treatment and caregivers, who can also help them in their recovery processes. Even at the call center, I've tried to say that when we get to a certain percentage of help, we need to now try to see how we can relate with one or two caregivers, because what we call accountability partnership is so important in recovery. So I think gradually we'll get there. We're ready to fight this war and we're ready to win. Thank you, sir.
Thank you very much. This is Dr. Hasia. This is definitely an area that we continue to ramp up. The parents are critical, and we have had training sessions at the communal level. We've had advocacies at the communal level where our personnel from the drug demand reduction units actually go and address parents about parenting and the need for them to look after their kids, give them love, show attention, and also come forward when they feel something awkward is happening to the children. We encourage them against stigma, for them to be bold. There's a term HIV. You hear somebody has HIV, you take another path so that you don't meet and get infected. But now all that has passed. So PTA, also, we are very involved in talking with the PTA, and as you said, we go to workplaces and so on. Parents also is very important, must be guided to set the right example. As I said in the beginning of my discussion, parents who themselves use substances, they are already showing the wrong steps to the kids. And I'm glad you pay attention in your remarks to aftercare, because the problem of relapse is always there. It's very, very important. In our own rehab facilities, once we discharge, we follow up. We keep pace with them wherever they are to see how they are coping and what their present circumstances are. The methadone clinics and those aftercare possibilities, the Nigerian government has just started, and I think they are doing a pilot on 3 states to give this type of medication after discharge that will mimic the effect of drugs, narcotic drugs without those addictive qualities, and they will be weaned over time. That has just started here. So this is a very important area that you raised on family. Everything starts on this fight from the family level, and we must intensify the efforts. And I must thank you for your commitment in all that you are doing.
All right, thank you very much there, His Excellency, the Chairmanship Executive. Let's quickly, time is fast running. Let's quickly get to Youth Action Network on Substance Abuse. That's most likely Ibrahim speaking from Gombe. Please go ahead.
Okay. Thank you so much, sir, for having me, and thank you for mentorship and guidance in all we are doing to achieve drug-free society. This topic today is very important, especially when we talk about prevention. I do tell people that $1 spent in prevention will save the government and the community 100 naira for treatment and then fighting insecurity. So it is very important. But here we have a little big challenge in Nigeria. I think we've started making some statements and campaign so that we'll have a kind of fund, that's a drug war fund, where civil society organizations, community-based organizations can be able to access fund in this issue of prevention. And another thing again, because His Excellency made a statement when he was talking about opening of chemists, people don't need degrees, some don't need even secondary school, they'll just go and open, trying to regulate that aspect. I think even in these prevention programs that we are holding, there are so many people that are causing harm because they are not knowledgeable. Instead of preventing, they are causing harm in the society, which we discover that fear tactics is no longer working. So people need to acquire knowledge. If that can be pushed to acquire knowledge, understand the evidence-based prevention, understand how to go about it, and then that will actually make more impact. And another thing again we looked at is the issue of family involvement in this fight against drug abuse. I think so many families, they are ignorant of what they can do and how they can be able to dictate their words or their children in the early stage of abusing drug. So I think let there be also so much concentration in the issue of family involvement, family prevention skills and all stuff. That will make a lot of move. We've started that in Gombe presently. We are working with the Algon, that's the 11th local governments. We are trying to pull in resources to see how we can get into the families within Gombe, because Gombe, the last statistics is telling us that we have about 13%. But the truth is that in Gombe State, I don't think there is a family that you cannot find somebody, one person at least, in this problem. So we try to see how we can involve families. And thank God we are working with the Ndlea command, which are very, very supportive in what we are doing in Gombe. So this is the list I think I want to add here. And I want to thank you once again. Thank you, Your Excellency, for your guidance and for your mentorship. We appreciate you and will continue to pray for Allah to continue to guide you so that we'll finish well. Thank you, sir.
All right, the chairman would most likely be running to another listing now, but let's quickly take this one person and then so that he can respond to. Okay, let's take Professor Muhammad Yahya. Please quickly, in 2 seconds, ask your question so that chairman can answer that in addition to that of Ibrahim. Please go ahead, Professor Yahya.
All right. Good evening, everyone. Happy to join you now. Please, I wanted to ask a question because this is an NDLEA handle. I'm from Kaduna State and I'm from Regasa to be precise. And I can categorically tell you we have issue of this drug abuse of 18 from tender age. I can categorically tell you that about 85% of our children are involved, directly involved in all these things. It has been a worrisome matter. We don't know how you can help us, how you can track a network or try to get us an office in Regasa, Kaduna. Please, I'm just pleading with you people to help us and just try to see how we can cope these menace. Thank you.
All right, thank you very much, Professor Yahaya. Let's invite His Excellency now to respond to Professor Yahaya, Dr. Azia, and then make his final remarks before he goes where he's going. Please go ahead, sir.
Oh, okay, thank you very much. I've already addressed Dr. Asia. Ibrahim, well done. Good to hear from you. I know we've been trying to meet. We haven't succeeded, but I think we soon will. But I must commend your efforts in drug-free Arewa movement. Actually, Gombe is not 13% but 23, I think, which is probably the highest state in the north, and that is why your efforts are very, very important. I should take the opportunity to state that your governor, who I have just left about 2 hours ago from a meeting, is a very, very committed governor. He's, of course, the Northern Governors Forum chairman, and his wife, also the First Lady, is one of the most committed because she has just done and commissioned the Hub Center. I mean, you couldn't be more committed than that in Gombe, which we appreciate. So we'll continue to see other ways of working and supporting you. And the matter of funding, which is probably the crux of what you stated, it's one of the areas that we ourselves need more help. But I know that with the commitment of the federal government, that is coming. Now, Professor Yahaya, we will get your details and connect you with our command in Kaduna. We'll connect you with our command in Kaduna so that they go in, make a proper assessment, and see how Regasa youths can be helped. Let me conclude this by expressing my deep appreciation and thanks to everyone present, especially the past guest speakers, for your commitment on this war against drug abuse in Nigeria. This is definitely a winnable war, and with your support, commitment, we will be further encouraged to do even more towards finding a lasting solution to the problem of drug use and drug abuse in Nigeria. Thank you very much indeed, and may God bless you all.
All right, amen there. Thank you very much, Excellency. I know you have to run to another engagement now, but then, he's promised that he will continue to listen to all the other contributions. So please stay connected, and we will continue the conversation until the hour of 5. That's the normal time of this conversation. So we'll take the next contribution from, Ibrahim Kuru, please go ahead. Yes, I've seen you have all of those raising their hands will definitely come to you. Ibrahim Kuru, is your network stable now to make your contribution, or we'll go to the next person? Yeah, please go ahead. Please go ahead now.
Yeah, good afternoon. How are you doing? I was actually thanking and talking to the chairman, but I know Mr. Mwafeni as well is capable enough to answer this. First of all, I need to thank all of you for your efforts, for your encouragement. Since the last time we met in November, I've done enough in my life and helped other people's life. My contribution today was actually about social media, because recently when I embarked on the advocacy journey to secondary school, a lot of them seem to have their own models of social media, which is if we are talking about our celebrities today and content they asking if the NDLA is looking for a policy where these contents are regulated, especially the fact that if they could be fined or jailed for posting videos and pictures with illicit drugs. So that is my question and contribution for today. Thank you very much.
All right, thank you very much there, Ibrahim Kuru. Definitely, I'm sure you are well aware that indeed we're monitoring developments on social media, and as you would have seen just a few days ago, you had the Nigerian Films Video Censors Board also coming out to take some steps in that direction. So definitely we are working with all stakeholders in this direction to ensure that what is shunned out on the social media space, especially by our celebrities, entertainers, are things that are of benefits to our young minds, not things that pollute them or mislead them. That you can rest assured. Okay, let's take the next one from Health Uncensored. Please go ahead.
Thanks for having me on. I appreciate it. I think this is a really important discussion, and it's great that you're utilizing these spaces to speak publicly in the community. Specifically, when it comes to drug abuse and drug addiction, I'm a researcher. I've been researching medical research for 12 years, and I think that it's important. I think it's really important to identify the variables that predispose someone to addiction or someone to seek out drugs. In my opinion, we start talking about mental health problems. When someone doesn't feel comfortable in their own skin, dealing with things like anxiety, depression, irritability, underlying inflammatory problems. You know, a lot of drugs, if you look at the medical research, they're anti-inflammatory. They suppress the immune system. And a lot of mental health conditions are driven by inflammation, neurological inflammation, inflammation in various parts of the body. And so when a person consumes a drug, let's say a narcotic, it temporarily relieves that inflammation, which provides symptom relief. So they're self-medicating. In my opinion, that's substantial, and it's significant when we talk about the war on drugs, is establishing why people are using drugs in the first place. I think it's a means of symptom management and self-medication. And until, as a community around the world, until we address that, what's driving these mental health problems, we'll never see any success. Here in the United States, 1/3 of the entire United States is currently taking psychiatric medication. 1/3. That's a very large number. 54% of children under the age of 16 in the United States are diagnosed with at least one chronic health condition. So, again, getting back to my original point, drug addiction is a symptom, in my opinion, of chronic illness of the mind and body. And we won't get rid of drug addiction until we're making people ill. What's making people sick? Thank you for letting me share.
Absolutely. That's awesome there, and very shocking also. Revelations out there. We appreciate you. Where you join us from which state in the US, please?
I'm in New Jersey.
Oh, okay. All right. Thank you very much. Yes, Alenko, please go ahead if you can hear me.
Okay. Thank you very much, Mr. Femi. Thank you very much, Your Excellency, for this wonderful space. We really appreciate. Let me go very quickly. My name is Salenko. I'm the press secretary of Voice of Ariwa. And we have been looking for a way actually to collaborate with this important organization for sensitizations and awareness about drug abuse. We say kudos to the organization. They have been doing an amazing work out there, and we want to support their fight against drug abuse. The problem of drug abuse is highly overwhelming, and it's not an international problem or a national problem, but basically a local problem. And we can support the upcoming ones, in a various way that we can be able to do that. Probably sometimes we need to talk to them in our local language for them to understand the consequences. Of course, most of the menace we are seeing today is as a result of this drug abuse. You can't imagine somebody who is sensible, who knows what he's doing, to be doing some of this nasty activity. So please, my request, we wanted to have somebody, maybe a PRO, who we can engage in probably with those weekly spaces and many sensitization, so that at least we'll be inviting that person to be giving us details, awareness, orientation about some of effect of those drugs and how people can be able to be free from them.
So where are you based, please? Where is your state? Where is your location?
Yeah, I based in Kano, but the organization,
Kano.
Yes, but the organization is based in Abuja, and we have connection within the 19 northern states.
Okay, where are you operating from? Just anywhere you are operating from. If you want our professionals, our experts, our officers to join you to lecture, to talk to you about these issues, please just let us know where you are based, and we would link you with the command on ground in those locations. You can rest assured you have that from the chairman, and he's right here on this space listening to this conversation. All right,
okay. Thank you very much, sir.
Just come to our DM.
Most of the activities is being done online. So
okay, yes, just come to our DM and say you want whatever you want. I'll run that with you, and then you can rest assured. Even if perhaps I'm chanced, I can always get involved also and support you if it's something that is virtual. Thank you very much, Salenko, for your contribution and the question. Let's quickly take, we have barely 18 minutes more. Okay, I'm seeing a friend also joining from New York in US, Igwe MNI, but I don't know, I only know you to be Igwe in Nigeria. I don't know you have changed to MNI. Please go ahead.
Yes, sir. Yes, sir. Can you hear me, sir?
Yes, you are loud and clear.
Thank you very much, Ogama Masole. I am calling you directly from New York, United Nations building.
We are glad.
If you go to your Twitter handle, I went to the UN building to praise NGLWA for their work. You are bringing pride to the world. Go to your Twitter handle, you will see me. I have sent congratulations for your hard work as a part of UN Drug Day, and we are pushing in for more integration of youth activity so that when they get involved in real activity, they will go away from drugs. For your information, on my arrival to Nigeria, I'm going to visit the office again because we are thinking about extending the collaboration and the advocacy beyond Nigeria and go beyond Niger and other neighboring countries and border communities so that they will also know the negative impacts of these drugs. Some women are being used to peddle this thing in and out. They don't know what they are carrying. And I want to appeal to you to talk to the Nigerian Investment Promotion Council, Export Promotion Council, to liaise with you to give another alternative for youths. Sometimes the youths who have money, they don't have the information or business opportunities that they can use so that they can get engaged. And by the grace of God, if they do this, one to one that leads to one to all, God helping us. For those of them that are calling from Kano, the Ministry of Youth are having collaboration with me now to start National Youth Reorientation Program in all the 6 geopolitical zones. And because of the strong partnership we are having with you, we are going to invite you Well, the force of Arewa should contact me because we are doing, as I'm arriving by next month, by the grace of God, we are going to do the first one in Kano. This war is something we must unite. It doesn't have political party, it doesn't have tribe, and I can tell you that we have done enough. We have done a lot. The one we did in Nasarawa has been paying off till today. The one we did in Jos has been paying off. And by the grace of God, God has given us that opportunity to be an international actor at the international level. Hence, we must continue to sustain and consolidate the synergy. And by the grace of God, God will help us. And I pray that by the grace of God, God will continue to give you the strength, give Ndlea the courage to make us proud. Nigeria is respected in the international community, and I'm proud to be here. And I'm proud to defend always. That is why I went to the United Nations building and made sure that I sent a thank you on the 26th of June. May God bless Nigeria and may God continue to help us to win this war.
Thank you very much. We appreciate you and your contributions always. That's Comrade Martins Igwe. God bless you, and please keep safe and enjoy the rest of your stay out there in New York, in the US, and at the UN complex. All right, thank you. We'll take the next contribution. Let's move to Felix Ogwezi. Please go ahead, Felix.
Thank you, sir. I hope you can hear me, sir.
You are very loud and clear. Please go ahead.
Okay, thank you so much. I appreciate this opportunity to speak on this platform. So I'll go straight to my questions. I have two questions. One is, how is Ndlea dealing with the distribution network of these drugs into our communities? Because I see that now there's a way they pass these drugs into the communities. People can easily have access. They know these people. They stay on the street. They reach out to them, and they have access to these drugs. And for me, this is a big challenge. Another question I want to ask is the issue of people smoking openly. There are places in where I reside in Sulere where people smoke openly, and people don't do that because you that I want to show where all the drugs get to the end users are all frustrated, and I feel if we do this, it will go a long way to help this fight. Lastly, I just want to also say that I want to encourage that NDLAs to see how they can also collaborate with the social work department, especially in universities that have this department, because one of the things they are trained is in act of advocacy. Let's see how they can collaborate with them and push this message, because this fight must be holistic. Thank you, and I appreciate your time.
All right, thank you very much. Let me quickly respond to the three questions raised by Felix there. One, distribution network into communities. Yeah, I can tell you that indeed the agency keeps doing its utmost best in this regard through intelligence gathering. And if perhaps you also have, if perhaps any intel for us, or you call our toll-free helpline, would definitely appreciate that. But then I can tell you that all of this we monitor and we interdict. That's why we've been able to take out of circulation more than 7.6 million kilograms of assorted illicit drugs. That's, if you want to put that in picture, just imagine more than 250 long trailers loaded with illicit drugs. That's exactly the volume we have taken out of circulation. Just imagine the impact of that if those things had escaped into our communities, our cities, and towns. So we continue to do this in collaboration with the support of you and every other person in our communities and the society at large. Then people smoking openly. Yes, indeed, there are some of these things that we're addressing through advocacy, and that's why we're working with all the stakeholders at the community levels, the traditional institutions, the residents, landlords associations, all of these gatekeepers at the community. There are people who are gatekeepers in those communities. They have a role to play. This is not all about law enforcement. We have said it over and over here. Not all about all of us, but if you know of anyone dealing or supplying them we are ready to take down or take out of circulation that person immediately. But for all of these small smokers and users all across the street corners or what have you, the communities themselves, they have roles to play. The gatekeepers in those communities have roles to play. They know who are the parents of these people. They know the houses they live involved, and that's one of the things we're doing with our WADA social advocacy initiative, to get everybody involved. Let's not say it's all about NDLA. No, it's the duty and responsibility of all of us. That's the way to address it. But then perhaps, well, if we have to move in, especially when there are such people are resisting the community gatekeepers, then you can get in touch with us. With the closest or nearest command of the agency to you will definitely move in. Collaboration with social work officers in the universities. Definitely we're working with the universities. We started drug-free campus campaign, where we're doing we're not doing this alone. We're working with the counseling units, the social work units of those universities to provide counseling for students, and that's why we are setting up WADA clubs or drug-free clubs in these institutions, to make sure that we drive this advocacy, we drive this process, and ensure that we discourage as many students as possible from getting into drugs. That I think let's take probably our last contribution on this space today. Let's take that from Irache Eledumare. Irache Eledumare, if you can hear me, please go ahead quickly.
Yeah, thank you, host. My question was a personal question for the chairman. I wanted to ask him what motivates him, that makes him keep his eye on the ball of this agency. But I guess that will be answered some other day. Now, the other question is, does this agency have a software system that runs the management of when you handle people who you deal with, basically the judicial system, the remand system, the supervisory systems, and all those things? I ask because we're considering introducing something like that down the line, or hopefully when we can get the funding for it, for the policing system. But I'm thinking, since your agency is a parallel agency that does almost similar things to the policing agency, it might be a very, very easier test case for that project when that is going to happen. The second question is, as a social advocate, I have produced music that speaks against drug abuse, and I haven't been able to find the right channel to hand it over to you guys. And so can you advise me on how I can do that?
All right, thank you very much, Irache Eledumare. We would be very glad to get whatever support, and also acknowledge and appreciate your contributions in this regard. Just come to my DM at the end of this space, and let's have a conversation. I'll tell you how to pass across your music, and then the other software thing you're talking about, I can have a better understanding if it's something we are using at the moment, or if it's something we are working on, and if it's something we would be interested in you supporting the agency with. Definitely I'll tell you, but then I have to have a very clear understanding of exactly what we are talking about. All right, thank you very much. I'd like to appreciate everyone that has been a part of this conversation today. Okay, I think I must give one more person the last opportunity before we close. And that's Pastor Iwe. Pastor Iwego. Pastor is always constant. Pastor, please go ahead. You have the last chance on this page today. Please go ahead and unmute yourself and let's hear from you. Your contribution or question. Okay, if Pastor is not ready, I'd like to appreciate all of our people that have been a part of this. On behalf of the Chairman Chief Executive, is listening to us. His handle is still very much live. It's just that he may not be able to contribute again because he's attending another, he's out of the office, attending another issue elsewhere. But I would like to appreciate on his behalf all of us that have either contributed, asked questions, and significantly impacted on this conversation, the quality of this conversation today. We appreciate you all. all our compatriots joining us from all across the world. Thank you very much. Starting from Dr. Kenny Lunloyo, John Ogunjemi, Loretta, Dr. Asia Adamubiu, Dr. Dokuma Dedeji, and all of you, including those that may not be able to recall at the moment. Thank you very much. We are grateful. We are grateful. We appreciate. I also like to thank my colleagues working behind the scene, right with me here. Talking of Francis, Shidi, Mahmoud, Dele, Val, Philemon, and the girls that Miriam, Neta, Comfort, Vicky, and the rest of you guys. I appreciate you. Now let's know that yes, it's Friday, and it's thank God it's Friday. Thank you guys. Please let's try as much as possible to keep it safe and ensure that we operate within the ambit of the law. God bless you all, and God bless the Federal Republic of Nigeria. Over to you guys. Do have a great evening. Bye bye.
Thank you very much, sir. For more information about the agency, our listeners can visit our website www.ndlea.gov.ng and perhaps our social media platforms of Ndlea in the school Nigeria on X, TikTok, YouTube, and Instagram. Don't forget that on Facebook it is at Ndlea. Do join us sometime next week for another edition of this wonderful program. I remain Mahmoud Isa. Over to you, Daddy Jelly.
So many dust in the west, away for the lala. Every day is the best, taking the lala. Whenever I close my eyes, I go remember. Water run out my eye when I remember. Say the last time we seen up for December. When you tell me say nah cocaine, I be the lala. Them say cocaine don't be lala. On the street